Welcome back to Hardball. With just 6 weeks until Election Day, President Obama spoke from a suburban backyard in Virginia today about some important parts of health care reform that kick in tomorrow.
Number one, Paul already mentioned, the issue of lifetime limits. That is not going to be the rule anymore after tomorrow. Number two, pre-existing conditions for children. Number three, we're going to make sure that if young people don't have health insurance through their employer, that they can stay on their parents' health insurance up to the age of 26. Number four, you're going to be able to choose your doctor and not have to go through some network in an emergency situation.
Well, apparently that's not all true. Item two, health care coverage for children with pre-existing conditions has now hit a snag. Some major health insurance companies have chosen to stop selling children-only policies in states like California, Illinois, Florida, and Connecticut. Is there anything lawmakers can do to fix that snag? Congresswoman Loretta Sanchez, Democrat of California, joins us from Capitol Hill. Congresswoman, you know, the biggest selling point to the middle class, I think it's fair to say, not just the working people, working class, if you will, was that pre-existing conditions would still be covered. Now we find that the children who have them, chronic illnesses, cannot get covered because the insurance companies in your state, for example, have shut down these policies. What can be done?
Yeah, what a shame. It's unbelievable that they would actually do that. It's, for example, what they did when they were trying to raise the rates artificially before these laws came in on individual policies. So once again, we see people trying to get through the loopholes or really not go to the intent of our law. Unfortunately, a lot of this is done on a state-by-state basis. I know that in California, there has been a bill passed up in the legislature that would say if you will not do children-only policies henceforth, then for 5 years you would be barred from writing insurance in the state. And so I don't know whether Governor Schwarzenegger will sign that, but that's certainly something that Californians have out there. And I think the bigger thing is, you know, the address of, yes, we could come back to the Congress and we could try to fix or amend this law in that way. But you all know that we're in the middle of election, so that's not going to get done. So then what is the redress? What is it that we can do? So obviously one of those things is when we do set up these exchanges in 3 years, we're going to get to choose. We're going to have a commission that's going to get to choose what policies are put in there. Certainly I would call a company that is not writing children's insurance a bad faith company, and I would suggest they wouldn't be found in that new 30 to 40 million person market that we will create.
So you could blackball companies, basically, that don't provide insurance for children with pre-existing conditions. You're saying you could fix it that way. Let's take a look at some of the facts. Let's look at the Congresswoman. Let's look at an estimated 80,000 California children currently without insurance, and as many as 500,000 nationwide would be affected by this. So there's a lot of kids out there who have, you know, obviously serious problems like leukemia and things like that, horrible diseases, won't get coverage.
Absolutely. And the sad thing is that who ends up paying for that? Again, it comes back on the taxpayer, because that means that these kids then go into Medicaid or some of these programs at the state level, and we end up paying for it. The taxpayers end up paying for it. And it's unfortunate because we have seen the profit margins of these companies be higher this year than at any other point.
Well, thank you very much, Congressman Loretta Sanchez, as always, from California. Thanks for that update. Wendell Potter's an insurance company and insurance industry whistleblower and former executive at Citgo. He's now senior fellow in healthcare at the Center for Media and Democracy. Okay, Wendell, you're the expert. You're very well respected on this, so let's nail this baby. Why did Congress, when they passed this bill, not see this coming? It's a market. People try to avoid costs they don't like. I can understand why an insurance company doesn't want to get nailed with having to insure people who are already sick, knowing that if they can't get to insure other people who are not already sick so they can share the costs. Didn't they see this coming, this need to have shared costs and shared profits, if you will?
You know, I think some members of Congress probably did, but the law that finally was passed has a lot of loopholes, and frankly, this points out why it was so important for us to have had a public option The rules of the road in health insurance are really set by big for-profit insurance companies who answer to Wall Street. Without the benefit of a public option, these guys will continue to be able to game the system between now and when this bill is fully implemented, and even probably beyond that.
Well, explain that. I know the case among progressives for a public option is probably a good one, so makes the case here. How would the fact that if you had an option out there, a public option, that did provide for insurance for individual children with pre-existing conditions going into coverage, how would that force a private sector company to match it, or would it?
Well, it could force it, because what is happening? Well, what is happening here is that some of these companies are getting out of this business, which means that all the companies will ultimately have to do that, because none of them will be able to absorb the risk. A public option, if it were in place and it were robust enough and was operating in enough states and had enough members, could make sure that it was setting the rules of the road, making sure
how does that work? I guess I'm getting back to, I know you're the expert, so tell me, how does having a public option force the ones that are offered in the private sector do the right thing here?
Well, because this is where, again, if it is robust enough, you have to have, for example, in California, if you had some of the very biggest companies out there who were staying with the children being able to stay in these plans, then the others would stay in there as well. If there is also some enforcement, and the Congresswoman is right, this also needs to be something that is dealt with at the state level as well. Lawmakers need to make sure that as they are developing these exchanges, that they can exclude these companies.
Well, I would see a problem right down the road there. If the government put together a public sector option, which could be a very good idea, all the private sector companies would say, great, you guys take care of the sick kids. We're going to have a pool of kids, a lot of whom are healthy. So we're going to make some money out there off kids who are not sick, while the government insures all the kids who are. Wouldn't that happen?
You have to make sure that it's set up in such a way that that does not happen.
How would you stop that?
Well, you're talking about adverse selection, and it would just have to be set up. I don't think we didn't get that far to see exactly how it would be set up, but I think you actually can do that.
I think Moynihan figured this out years ago. The public sector ends up doing stuff that doesn't make money. In other words, insuring kids who are sick already, whereas the private sector ends up making money off things that do make money. In other words, insuring healthy people.
You will actually you will continue to see that, because again, you are being this industry is led by Wall Street, and that is the way it will continue to be. They have an obligation to meet the expectations of shareholders. So you're going to see this going forward, unfortunately.
You know, let me tell you, we had a big problem, and you tell me right now how they could have gotten a public option through with a Congress which was recalcitrant, even to do what the president pushed them to do.
You couldn't have done it, because the influence of the insurance industry and its allies was so intense, so effective, that it wasn't going to happen. And of course, the industry knew that without a public option, with some of the other things that got in this legislation, that they would be able to find these loopholes and to game the system as we're saying they're doing.
Well, we better put on our seatbelts, because it's going to get more right-wing and more private sector and more anti-government and more anti-public option and more anti-social policy down the road if this Democratic Congress goes down.